Question 1. A patient is diagnosed with cholecystitis. Which anatomical structure is inflamed? A. Liver. B. Gallbladder. C. Pancreas. D. Common bile duct. Answer: B. Gallbladder. This question tests the understanding of medical root words related to the digestive system. The key term is cholecystitis, which breaks down into cholecyst/o, meaning gallbladder, and itis, meaning inflammation. Therefore, cholecystitis is the inflammation of the gallbladder, a small organ that stores bile produced by the liver. For example, a surgeon might perform a cholecystectomy, or removal of the gallbladder, to treat this condition. A helpful tip is to remember that chole relates to bile and cyst relates to a sac or bladder, so together they point to the gallbladder. Question 2. Which term describes the surgical suturing of a divided nerve? A. Neurolysis. B. Neuroplasty. C. Neurectomy. D. Neurorrhaphy. Answer: D. Neurorrhaphy. This question focuses on surgical suffixes, and the key clues are suturing and nerve. The suffix rhaphy specifically means surgical suturing or repair, while the root word neur/o refers to a nerve. Combining them gives you neurorrhaphy, which is the correct term for suturing a nerve back together. The other options describe different procedures. Neurolysis is the destruction of nerve tissue, neuroplasty is surgical repair of a nerve, and neurectomy is the removal of a nerve. To remember this, think of rhaphy as rhyming with so happy, helping you connect it to the action of suturing. Question 3. In the anatomical position, the ulna is located ______________ to the radius. A. Medial. B. Lateral. C. Proximal. D. Distal. Answer: A. Medial. This question tests knowledge of directional terms within the context of the standard anatomical position. In this position, standing upright, palms facing forward, the key word is understanding the relationship between the two forearm bones, the ulna and the radius. The ulna is on the side of the little finger, which is closer to the body's midline, making it medial to the radius, the thumb side bone. A practical way to visualize this is to hold your arms out with palms forward. The bone on the pinky side, ulna, is medial, or toward the middle, while the thumb side, radius, is lateral, or away from the middle. Remember ulna and under to associate it with the bone that is underneath when you pronate your hand, turn it palm down. Question 4. The mitral valve is located between which two chambers of the heart? A. Right atrium and right ventricle. B. Left atrium and left ventricle. C. Right ventricle and pulmonary artery. D. Left ventricle and aorta. Answer: B. Left atrium and left ventricle. This question assesses specific knowledge of heart anatomy, focusing on the location of its valves. The key term is mitral valve, also known as the bicuspid valve. This valve controls blood flow between the left atrium, which receives oxygenated blood from the lungs, and the left ventricle, which pumps that blood out to the rest of the body. You can remember the order of blood flow through the heart valves with the mnemonic: try pulling my aorta for tricuspid, pulmonary, mitral, aortic. This helps place the mitral valve correctly between the left atrium and left ventricle. Question 5. The functional units of the kidney responsible for filtering blood and forming urine are called: A. Alveoli. B. Neurons. C. Nephrons. D. Villi. Answer: C. Nephrons. The question asks to identify the functional units of the kidney. The keywords here are kidney and filtering blood, which are the primary roles of this organ system. The correct answer is nephrons, which are the microscopic structures within the kidneys that perform filtration, reabsorption, and secretion to produce urine. Alveoli are air sacs in the lungs, neurons are nerve cells, and villi are projections in the small intestine, so understanding the function of each structure is key to selecting the right answer. A good way to remember this is that the medical root word for kidney is nephr/o, which directly corresponds to the term nephron. Question 6. A transverse plane divides the body into A. Right and left portions, B. Anterior and posterior portions, C. Superior and inferior portions, D. Medial and lateral portions. Answer: C. Superior and inferior portions. This question tests the definition of the body's anatomical planes, with the keyword being transverse plane. This specific plane, also called the horizontal plane, runs parallel to the ground and cuts across the body, dividing it into upper, superior, and lower, inferior, sections. An MRI or CT scan is often viewed in transverse slices. To keep the planes straight, remember that a transverse plane cuts across your torso, creating a top and bottom half, while a sagittal plane separates the sides and a coronal plane separates the front and back. Question 7. The term for surgical fixation of the uterus in a suspended position is A. Hysterectomy, B. Hysterorrhaphy, C. Hysteropexy, D. Hysteroscopy. Answer: C. Hysteropexy. This question requires knowledge of surgical suffixes combined with an anatomical root word. The keywords are surgical fixation and uterus, hyster/o. The suffix pexy means surgical fixation or suspension of an organ, making hysteropexy the precise term for surgically securing a prolapsed or displaced uterus. The other options are incorrect. Hysterectomy is removal, hysterorrhaphy is suturing, and hysteroscopy is visual examination of the uterus. Remember that pexy sounds like pegs, as in using pegs to fix something in place. Question 8. Which part of the brain is primarily responsible for coordinating voluntary movements, balance, and posture? A. Cerebrum, B. Cerebellum, C. Medulla oblongata, D. Pons. Answer: B. Cerebellum. This question tests knowledge of the major functional areas of the brain. The keywords coordinating voluntary movements, balance, and posture point directly to the function of the cerebellum. Located at the back of the skull beneath the cerebrum, the cerebellum fine-tunes motor activity, ensuring smooth and precise movements rather than jerky, uncoordinated ones. For example, the cerebellum is critical for actions like walking, catching a ball, or playing a musical instrument. An easy way to distinguish it is to remember that the cerebrum is for thinking, while the cerebellum is for balance and coordination. Question 9. The patella is an example of what type of bone? A. Long bone, B. Flat bone, C. Irregular bone, D. Sesamoid bone. Answer: D. Sesamoid bone. This question assesses knowledge of bone classifications, focusing on a specific example, the patella, kneecap. The patella is a classic example of a sesamoid bone, which is a type of bone embedded within a tendon or muscle. It acts like a pulley, providing a smooth surface for the tendon to slide over, increasing its mechanical advantage. While other bones fit the other categories, the patella's unique location within the quadriceps tendon is its defining feature. Think sesamoid like sesame seed, because these bones are often small and seed-shaped, embedded in tendons just like the patella. Question 10. The exchange of oxygen and carbon dioxide in the lungs occurs in which structures? A. Bronchi, B. Trachea, C. Alveoli, D. Pleura. Answer: C. Alveoli. This question is about the primary function of the respiratory system, pinpointing the exact location of exchange of oxygen and carbon dioxide. This vital process, known as gas exchange, occurs in the alveoli, which are tiny, thin-walled air sacs at the very end of the bronchial tubes. Their structure provides a massive surface area for oxygen to diffuse into the blood and carbon dioxide to diffuse out. The trachea and bronchi are airways that conduct air to the alveoli, but the actual exchange does not happen there. A simple way to remember is that the alveoli are the action sites deep within the lungs where the real work of breathing happens. Question 11. Which term describes a condition of having a slow heart rate? A. Tachycardia. B. Arrhythmia. C. Bradycardia. D. Cardiomegaly. Answer: C. Bradycardia. This question tests the meaning of medical prefixes related to the cardiovascular system. The key clue is slow heart rate. The prefix brady means slow, and cardia refers to the heart, so bradycardia is the medical term for an abnormally slow heart rate, typically defined as under 60 beats per minute in an adult. In contrast, tachycardia, tachy meaning fast, is a fast heart rate. Knowing these opposite prefixes is crucial for accurate coding of heart conditions. To remember, think of a Brady little snail moving very slowly. Question 12. Which of the following is the longest segment of the small intestine? A. Duodenum. B. Ileum. C. Jejunum. D. Cecum. Answer: B. Ileum. This question requires specific anatomical knowledge of the digestive tract, specifically the small intestine. The small intestine is composed of 3 segments: the duodenum, the jejunum, and the ileum, in that order. The ileum is the final and longest section, connecting to the large intestine at the cecum. To correctly answer, you must know the relative lengths of these parts. A helpful mnemonic to remember the order is Dow Jones Industrial for duodenum, jejunum, ileum. Question 13. A patient lying on their back with their face upward is in what position? A. Prone. B. Supine. C. Lateral. D. Dorsal recumbent. Answer: B. Supine. This question tests the understanding of patient positioning terminology. The keywords lying on their back and face upward are the definition of the supine position. In contrast, the prone position is lying face down. An easy way to remember the difference is that supine has the word up in it, reminding you that the patient is facing up. This terminology is fundamental for accurately describing procedures, examinations, and patient status in medical records. Question 14. Melanin, which determines skin and hair color, is produced by which type of cell? A. Keratinocytes. B. Adipocytes. C. Melanocytes. D. Fibroblasts. Answer: C. Melanocytes. This question assesses knowledge of the integumentary system and cellular function. The keyword melanin directly points to the correct answer. Melanocytes are specialized cells located in the epidermis, the outermost layer of skin, that are responsible for producing the pigment melanin. The name itself is a clue. Melano refers to the black pigment, and cyte means cell. Keratinocytes are the main cells of the epidermis, adipocytes are fat cells, and fibroblasts produce connective tissue, none of which produce melanin. Question 15. The term arthrocentesis refers to what procedure? A. Surgical fusion of a joint. B. Puncture of a joint for fluid removal. C. Visual examination of a joint. D. Surgical repair of a joint. Answer: B. Puncture of a joint for fluid removal. This question tests the meaning of a procedural term by breaking it down into its word parts. The term arthrocentesis combines the root arthro/o, meaning joint, with the suffix centesis, meaning surgical puncture to remove fluid. Therefore, Arthrocentesis is a procedure where a needle is inserted into a joint capsule to aspirate, or withdraw, synovial fluid for diagnostic purposes or to relieve pressure. For instance, a doctor might perform an arthrocentesis on a swollen knee to test for infection or gout. Remember that centesis is always about puncturing to remove fluid. Question 16. The Eustachian tube connects the nasopharynx to which part of the body? A. Inner ear. B. External ear. C. Middle ear. D. Cochlea. Answer: C. Middle ear. This question asks for specific anatomical knowledge related to the ear. The key structure is the Eustachian tube, also known as the auditory tube. Its primary function is to connect the back of the throat, nasopharynx, with the middle ear, the air-filled space behind the eardrum. This connection allows for pressure equalization between the middle ear and the outside atmosphere, which is why yawning or swallowing can help pop your ears when changing altitude. Remembering that this tube's job is to equalize pressure helps link it to the air-filled middle ear cavity. Question 17. Which endocrine gland is located in the neck and is responsible for regulating metabolism? A. Adrenal gland. B. Pituitary gland. C. Pancreas. D. Thyroid gland. Answer: D. Thyroid gland. This question tests knowledge of the endocrine system, asking you to identify a specific gland based on its location in the neck and its function of regulating metabolism. The thyroid gland, situated at the front of the neck just below the Adam's apple, produces hormones that control the body's metabolic rate, heart function, and digestive function. The adrenal glands are on the kidneys, the pituitary is in the brain, and the pancreas is in the abdomen, making the thyroid the only correct option based on the anatomical and physiological clues. A good tip is to associate the T in thyroid with thermostat, as it acts as the body's thermostat for metabolism. Question 18. The term myelopathy refers to a disease of the A. Muscle. B. Bone marrow or spinal cord. C. Brain. D. Myelin sheath. Answer: B. Bone marrow or spinal cord. This question tests the understanding of a potentially confusing medical root word, myel/o. This root has a dual meaning, referring to either the spinal cord or the bone marrow, and the suffix pathy means disease. Therefore, myelopathy is a general term for a disease or disorder affecting one of these two structures. For example, cervical myelopathy is a condition caused by compression of the spinal cord in the neck. To avoid confusion with my/o, muscle, remember that myel/o has an L in it, like spinal or cell, as in a bone marrow cell. Question 19. A coronal plane is also known as the A. Sagittal plane. B. Horizontal plane. C. Transverse plane. D. Frontal plane. Answer: D. Frontal plane. This question assesses knowledge of anatomical planes and their synonyms. The keyword is coronal plane, which is an imaginary vertical plane that divides the body into anterior, front, and posterior, back, sections. The term frontal plane is used interchangeably with coronal plane. For example, a chest X-ray is typically taken in the frontal, coronal, plane. A way to remember this is to think of a crown, corona, worn on the head, which would visually separate the front of the body from the back. Question 20. In a female, fertilization of an ovum by a spermatozoon typically occurs in the A. Uterus. B. Ovary. C. Vagina. D. Fallopian tube. Answer: D. Fallopian tube. This question requires specific knowledge of the female reproductive system and the process of conception. The keyword is fertilization, which is the fusion of an egg, ovum, and sperm. This event most commonly takes place in the fallopian tube, also called the uterine tube, which serves as the pathway for the ovum to travel from the ovary to the uterus. The fertilized egg then continues to the uterus, where it implants for gestation. A simple way to remember this is that the fallopian tube is the meeting place between the egg's starting point, ovary, and its destination, uterus. Question 21. Which of the following is considered the master gland of the endocrine system because it controls the functions of many other glands? A. Thyroid gland. B. Pineal gland. C. Pituitary gland. D. Adrenal gland. Answer: C. Pituitary gland. The question asks to identify the master gland of the endocrine system based on its function of controlling other glands. This is a classic description of the pituitary gland, a small, pea-sized gland located at the base of the brain. It secretes hormones that regulate a wide range of bodily functions and control the hormone production of other endocrine glands like the thyroid and adrenal glands. For example, the pituitary produces TSH, thyroid-stimulating hormone, which tells the thyroid gland to release its own hormones. Think of the pituitary as the manager of the endocrine system, directing the work of other employee glands. Question 22. The surgical creation of a new opening into the colon is called A. Colectomy. B. Colopexy. C. Colostomy. D. Coloscopy. Answer: C. Colostomy. This question tests your knowledge of surgical suffixes related to the digestive system. The key phrases are surgical creation and new opening, which point to the suffix stomy. The root word col/o refers to the colon, so a colostomy is a procedure that creates an artificial opening, a stoma, from the colon to the outside of the abdominal wall. In contrast, ectomy means removal, pexy means fixation, and scopy means visual examination. Remembering that stomy creates a stoma or opening is key to distinguishing it from other surgical procedures. Question 23. The aorta receives oxygenated blood from which chamber of the heart? A. Right atrium. B. Right ventricle. C. Left atrium. D. Left ventricle. Answer: D. Left ventricle. This question assesses knowledge of the pathway of blood flow through the heart. The keywords are aorta and receives oxygenated blood. The left ventricle is the powerful final chamber that pumps oxygen-rich blood through the aortic valve and into the aorta, the body's largest artery, for distribution to the rest of the body. Blood flows from the left atrium into the left ventricle before being ejected into the aorta. A good tip is to remember that the left side of the heart handles oxygenated blood, and the ventricle is the pumping chamber that sends it out to the body. Question 24. Which cranial bone is a light, spongy bone located between the eyes that forms part of the nasal cavity and the orbits? A. Sphenoid bone. B. Occipital bone. C. Ethmoid bone. D. Temporal bone. Answer: C. Ethmoid bone. This question asks for the identification of a specific cranial bone based on its description as light, spongy, and its location between the eyes. This accurately describes the ethmoid bone, an unpaired, complex bone that separates the nasal cavity from the brain and is a major supporting structure of the nasal cavity and orbits. The sphenoid bone is behind the ethmoid, the occipital is at the back of the skull, and the temporal bones are on the sides. To remember it, associate the ethmoid with the ethnic features of the nose and central face. Question 25. The layer of the skin that contains blood vessels, nerves, hair follicles, and sweat glands is the A. Epidermis. B. Dermis. C. Subcutaneous layer. D. Stratum corneum. Answer: B. Dermis. The question tests knowledge of the layers of the integumentary system, the skin. The key is identifying the layer that contains complex structures like blood vessels, nerves, and hair follicles. This is the dermis, the middle layer of skin located beneath the epidermis, which provides structural support and contains these vital components. The epidermis is the outermost, protective layer, while the subcutaneous layer below the dermis is primarily composed of fat. Remember that the dermis is the deep and dynamic layer where most of skin's functional hardware is located.